Hi, my name is Bob Hill with Ergotron Healthcare, and with HIMSS being canceled this year, we are bringing to you a presentation that we were scheduled to do in the Intelligent Health Pavilion. And the title of that presentation is Fulfilling the Quadruple Aim with Clinician-Centric Ergonomics. In some form or fashion, we help healthcare organizations achieve their triple aim and quadruple aim goals. Some may service one of the aims particularly well, while others affect all three aims. Ergotron, for instance, focuses on the fourth aim to do our part in helping healthcare organizations achieve their triple aim objectives. Whether it's AI, AR, EMR, user interfaces, telehealth, client devices, peripherals, diagnostic equipment, or clinical communications, there are many components affecting caregiver wellness. Fulfilling number 4 impacts number 1, number 2, and number 3. Caregiver experience, nurse fatigue, the joy of work factor. It impacts patient experience, population health management, and per capita healthcare costs. Let's take a look at the impact of physical health and metabolic health on our bodies and our healthcare system. We are not only employees and healthcare employees, we are also patients. Across the top of this slide is our lifeline from birth to age 100. First, we'll take a look at musculoskeletal health. While seemingly simple, the development of musculoskeletal disorders such as neck, wrist, and lower back pains can start out as bothersome when we're younger and turn into something bigger as we get older. And these musculoskeletal disorders can accumulate over time into something more significant and even debilitating cumulative trauma disorders. This is why preventive and reactive ergonomics is so important. Now let's take a look at metabolic health. Sedentary lifestyles, learned styles, and work styles, they begin early with us adults passing down this learned behavior of sitting to our children. And then we also need to think about the built spaces that we live and work in, learn in, and how they inhibit or promote movement. For instance, after about 30 minutes of sitting, our metabolism decreases, our heart rate drops, we burn fewer calories, our insulin effectiveness tapers off. Sedentary lifestyles are developing at earlier and earlier ages as we are seeing childhood obesity rates soar, juvenile onset type 2 diabetes, high blood pressure, and other cardiovascular diseases affecting youth and even compounding into comorbid conditions at a premature age. This is why we need to create learning and working environments that promote movement. Musculoskeletal disorders that turn into cumulative trauma disorders and chronic metabolic conditions that compound into comorbidity not only affect daily quality of life, but also become costly for individual employees, employers, insurance companies, and society, as measured by dollars, expenses, and productivity. We at Ergotron seek to prevent and delay conditions that turn people and employees into patients. Let's take a look at the role of physical strain in clinical healthcare roles. Physical strain that fatigues caregivers throughout their day and their career, these musculoskeletal disorders that can compound into cumulative trauma disorders. Among hospital workers, the top causes of injury are overexertion, which largely comes from patient and material handling, slips, trips, and falls. There's a lot of emphasis on the patient falls, but don't overlook the caregivers, as this is 1/4 of the reported injuries. Sharps and needle stick injuries, and workplace violence. Related to this is ergonomics, and there are 3 main ergonomic stressors. First, the force to complete a task. While most of the time we think about physical force, think also of other types of barriers and obstacles that caregivers need to navigate and overcome. For instance, organizational or cognitive. Second, awkward or static postures, such as bed to chair or bathroom to patient handling, or retrieving supplies from some creative or bizarre storage space. Third, repetitiveness. Think about typing, mousing, and interacting with the EHR for about a half of a nurse's shift. The most common injuries are sprains and strains, and while it's easy to think about patient transfers being high risk, we cannot overlook the significance of cumulative trauma disorders. Yale ergonomists, for instance, report that cumulative trauma disorders represent the bulk of the ergonomically related injuries and accumulate from months or even years of intensive repetitive motions or activities performed in an ergonomically unsound manner. Fortunately, most of these cumulative trauma disorders can be prevented through a series of simple changes in equipment and practices, along with the adoption of several stretching and strengthening exercises. With the context of these types of ergonomic stressors and injuries, let's now take a look at the general breakout of a nurse's tasks during a shift. Charting and documenting consumes about 1/3 to 1/2 of a nurse's shift, And a U.S. survey shows that about 50% of nurses experience some level of discomfort while doing data entry, including wrist, neck, and back pain. From the previous slide, we saw that the most common injuries are sprains and strains. And again, while it's easy to think about patient transfers as being high risk, we cannot overlook the significance of cumulative trauma disorders throughout our caregiver shifts and careers. So to summarize a couple thoughts here, less time is spent moving and handling patients, but it is high strain. A lot more time is spent on documentation and working with the EMRs, and this is perceived as less strenuous. But half of the nurses in one large survey reported experiencing discomfort while doing data entry, such as wrist, neck, and back pain. This is how and where cumulative trauma disorders build and show up. 60% of nurses are concerned that their job is negatively impacting their overall health, and 44% of the nurses surveyed admittedly report that they are less friendly or engaging with patients and modify or limit their activity on the job. The 50% of nurses shift that is spent documenting at a computer workstation should not be the time that they are exacerbating their body dynamic problems. Indeed, nurse discomfort from musculoskeletal disorders and cumulative trauma disorders and compromised metabolic health does indeed impact patient experiences. These musculoskeletal disorders and cumulative trauma disorders from charting are slowly fatiguing our nurses. Bedside documentation, whether by medical cart or an in-room workstation, reduces errors and helps improve care. Only 20% of nurses report that they do the bulk of their reporting and charting in the room with their patient. What is really driving this? Is it because of space limitations? Is it because of technology placement, organizational practices, personal preference? Also, 72% of nurses report staying after their shift to finish charting. Why is this? We need to continue bringing stakeholders together to address this. The clinician, IT, interior designers, architects, patient and family advocacy groups. The collision of the allocation of time and EHR difficulties blend to create their own obstacle. Because of organizational, cognitive, and physical ergonomic challenges that a nurse navigates throughout their shift, nurses often work beyond their shift to complete their charting. Nurses who work 12 plus hours a day and 40 plus hours a week committed more errors. In the patient-facing areas, sedentary work styles are not as prevalent as they are on the admin and support side. Lots of cubes, offices, sit-down meeting rooms. Sedentary behavior has a negative metabolic effect that manifests itself as compromised productivity. After just 30 minutes of sedentary behavior, our metabolism drops. Conversely, by introducing low-level physical activity into our daily work styles and learn styles, such as sit-stand desk, active work environments, standing meetings, etc., we can maintain and even improve our metabolic health. Ergotron's research via universities focuses on three key areas. First, metabolic: heart disease, diabetes, high blood pressure, cancer. Number two, musculoskeletal: carpal tunnel, neck pain, back pain, joint issues. And number three, performance and productivity. Introducing low-level physical activity in everyday workstations helps with physical and metabolic health, employee engagement, and productivity. It has been shown in studies that the more time that a nurse spends interacting with the patient, stay times are shorter, injury rates are less, and hospital-acquired infections are reduced. When we look at HCAHPS scores as an indicator of quality of care, we see that better environments equate to higher scores, and we also see that better environments are good for patient or customer recommendations. So research supports the notion that happier nurses equal happier and healthier patients. When nurses are more satisfied with their work environment, patient satisfaction scores improve, as measured by the HCAHPS scores and patient recommendations. But what about the metric that really matters, patient outcomes? Satisfied and happier nurses also contribute to better clinical outcomes and readmission rates. Through various survey mechanisms, quality of care increases 5 to 20%, a decrease in infection rate by 87%, decrease in injury falls by 17%, and decrease in hospital-acquired pressure ulcers by 59%. So going back to the beginning of our conversation, we need to look at our staff as both human beings and caregiver employees. Our work environments need to maintain physical, metabolic, and emotional health for productivity purposes and to prevent our employees from entering the healthcare system prematurely as patients. Your safety and risk officers understand and are immersed in this and can be great allies in this planning quest. They can help with understanding the operational impact of employee healthcare costs and lost time and injury costs due to ergonomic issues. Ergonomics is not just for reactive requests and squeaky wheels. Ergonomic injuries are real, they're painful, debilitative, costly, and can be addressed on a proactive and preventive level. Not all workstations and carts are created equally. Push your vendors to help you understand the details and the user forces required for using, moving, and stowing their wall-mounted workstations and their cart workstation products. Let's talk a little bit about power anxiety as well. Similar to our experience of always wanting to make sure our cell phones are charged and ready, nurses want to make sure that their cart is always charged and ready to go as well. Think about all the different devices now in a clinical setting that have some sort of battery power that need to be managed. Mobile carts with power sources are no different. There's a couple different versions of these carts. There's a larger capacity battery and one that's about half capacity battery. And each battery has its application. For instance, if you have a cart that is constantly moved from room to room to room, say for instance registration, having a long charge like that's going to be very important. If you have a cart that stays in a room that is plugged in most of the time but is only unplugged and used for about 30 minutes at a time or a couple hours at a time, then a battery that weighs a lot less could be a great application there. So think about the use scenario and how much runtime you actually need. Of course, we all want to have a very long running battery, but is that really what's needed? Because if you can reduce your runtime, then you're also going to reduce the weight of that cart for your nurse. Thank you for joining us for this presentation. Hopefully you found it informative. If you or anybody on your staff would like to have this discussion in more detail, please contact your Ergotron Healthcare field rep.